Good morning. This is Dr. Timothy Scott Beck here at Life Point Medical. And I'll say good morning to you and let you know that we are up and running this morning. And we do want to hear from you if you're having medical problems, so maybe we can give you some help. All right, let's talk about a few things, do some housekeeping things, things that will help you interact better with our office and get things done when you need them, okay? Because we do lots of that, lots of just helping people get what they need when they need it. So the thing I want to talk about today is refills. So a lot of times people need refills on their medicines and they don't have an appointment. So let's talk about how this works out. First of all, if we're giving you a maintenance med, like a blood pressure medicine or a diabetic medicine or something that we know you're going to be on for the next year, we always try to give you a year supply. That's 90 pills with 3 refills. And then we try to make sure that you are going to be seen somewhere around that time so that we can do it. We can make sure you don't run out of your meds. And I never want you to run out of your meds if you're a patient of mine, okay? You can reach out to us. We will refill your meds promptly and aggressively. We really don't feel like it's good medicine for you to run out of your meds. So if you need a medication refill, we always recommend that you call us, not the pharmacy. Go ahead and call us first, because if you call the pharmacy, it sets off a chain of things that has to be done that are way more complicated, and it makes more work for us and the pharmacy if you have to do that. So I want to gently ask you, if you need a medication refill, call us, and we will tell you whether or not the refill is appropriate. And if you need an appointment for that refill, we'll go ahead and get that set up for you. And no, we do not require an appointment for all refills. We do that if there's a problem with the refill or we are having an issue. If you've not been seen in an interval of time, which is over a year, we'll want to see you to get that taken care of, okay? Now, the flip side of that is we also want you to bring your meds to your appointments. And so the ideal situation is that you have your weekly meds in a weekly pill organizer, and then you keep all your bottles in a bag to the side. When you come to see me, I want to see the bag to the side because I want to see exactly what meds you're on, and I want to see the labels on the bottles. But the cool thing is, if you need refills during that appointment, we go ahead and set those up for you. Okay, we go ahead and make sure that happens. That's something that we do when we reconcile your meds. If you don't have a certain amount of refills in there, we go ahead and put that in automatically so that we can get that done. So if you need refills, don't call the pharmacy, call us. We've told the pharmacy to put it back on you guys, for y'all to call us for the refills, because we can do it a lot quicker and a lot more streamlined if you call us first. If you need a refill, call us. If you need an appointment, they'll let you know at that time, and you can come on in and we'll get those refilled for you. And if you bring your meds, an added bonus if you bring your meds to the appointment is we will check for refills and automatically do them. And then last but not least, as far as, I was talking last week about cholesterol, and we talk about blood pressure, and we talk about diet and exercise. We talk about all this stuff is to help us with our vascular disease, our vascular tree, our arteries, which supplies blood everywhere, because that's where a lot of problems happen. So one of the things we do every year, whether you know it or not, is we screen everybody for diabetes, okay? And we have a way that we do it. We just check a simple blood test when you're coming in, and if it's a certain range, we have a secondary test we can do, an A1C, if you are at risk for having diabetes. So we do screen every patient annually, or whoever gets annual labs. We try to do it on everybody, but sometimes people won't let us. That is part of the wellness, is to make sure that you've been screened for diabetes in the last year. And we have a simple test that we do for that. And we do those quite often. And again, we try to do it every year. So yes, we are screening you for diabetes. And the way you screen somebody for diabetes is you check a random sugar and see, is it high, is it low, or is it normal? Because if it's normal, you probably don't have diabetes. And if it's elevated, that doesn't mean you have diabetes, but that means we need to look and see whether or not you got diabetes. So that's how that works. Again, diabetes affects your vascular system. That's why we care about it, because we know that if you don't have good controlled diabetes, your arteries and veins take a hit for it. Okay, thank you so much for listening to me today. Our text line is 706-607-6685. You can use that to get a hold of us. You can call us at 706-782-0016. You can go to our website, drtspec.com, or you can email us at office@drts.com. Thank you so much for listening to me. Have a wonderful day.